Jess, I'm your Spyglass rep. Today we're going to do a quick in-service of the setup and when you would use Spyglass. So Spyglass is typically going to be used for lap choles with cholangiograms. When you'll use it is if your cholangiogram is positive for a stone. So if it's positive for a stone and there's a stone in the common bile duct, they'll use the Spyglass equipment to go fish out that stone to save the patient an additional procedure like an ERCP to get their stones removed. So if you have a lap chole with cholangiogram and your physician is open to using the Spyglass, you're going to get the cart in the hallway where the bathrooms are. You'll bring it into the room, and then you'll want to grab a freestanding monitor and bring it into the room as well. Everything that you need for the procedure should be on the cart. In terms of setup, two big things with setup are first an IV bag, so just a pressure bag, 1,000-liter saline bag, IV tubing that I can usually just ask anesthesia for, just spike tubing on one side, Luer lock on the other. And then once that's set up, that will connect to your scope ultimately, and we'll come back to that in a minute. Next is going to be your image. So the power box for the Spyglass is this box right here. It'll have power just from a regular outlet. You'll hit this button here to turn it on. It'll take about 30 seconds to vamp up. All the lights will turn on and then you'll know it's good to go. There's a black cord attached to the back. It's a DVI cord that will then attach to the back of your monitor, and it's a DVI connection. So it's going to go into the spot that says DVI. It says DVI right behind there. Once it's plugged in and your monitor is on, as long as you can click to the input of DVI on whatever your monitor is, you should get a screen that says Spyglass Discover like this. So this is what you want to see to know that once you plug the scope in, you're going to get your image. Then when it's time to use the scope, we're going to take it out of the box. These are the scopes on the cart. They come in these big boxes. You'll take it out of the box, and then you'll open the tray onto the sterile field. Then the scope will be coiled up on the inside. You'll take everything out and uncoil it. This one's been through the ringer a little, but you're gonna have a couple things here. This will go to the physician, so this is the actual scope itself. This will all come off the sterile field. The big white piece is what's gonna plug into the controller. So blue arrow up, it'll plug into the socket, you'll hear a little click, and then you'll get your image over here. The other two tubes that are going to be off the sterile field at this point are going to be for suction and irrigation. So there'll be two. You want the one with the white, you can just turn the stopcock to be off in the off position because we're not going to use that one. That's for suction. But the one we are going to use is the one for irrigation. So there are 3 water droplets and it's a blue cap. And your tubing that we set up prior, the IV bag and the IV tubing, will just lock into the blue cover. Then you'll have irrigating drip throughout the scope for the whole procedure as needed, and then you can roll up or roll down the little lever on your saline tubing. Throughout the procedure, they may use other tools to help them get access to the biliary system or other things like grabbing stones. So what you'll see is everything that they may need for the procedure will be on this cart. There'll be wires, sheaths, a couple different things, but they'll all be here. So baskets for grabbing the stones are on the bottom. Balloons for dilating the cystic duct are here. If you're going to use a balloon, it'll be with an inflation device, which is the Encore. There is a sheath that fits through a 5 trocar. Most of the time when they do this procedure, they normally for lap choles do 4 ports. They might add a 5th port and put the sheath through the 5th port. And then last thing is their cholangiogram catheters on the back. They're tall and skinny and we like to keep them straight, so we put them on the back of the cart. I think that's it. Thank you so much. Oh, last thing is if you have a case, My phone number and information is on top of the power box. So just give me a call or text and I will come support the case. Thank you.